Good afternoon, everyone, and welcome to this free live webinar hosted by Mail and Guardian and brought to you by UNICEF. Of course, what we're discussing today is COVID-19 versus child nutrition and child nutrition services to prevent malnutrition and protect children. We know that this is an extremely important conversation. And just to let you know who I am, my name is Gershwell Brooks. I am currently the communications coordinator for the South African Human Rights Commission. I've been working in media, civil society, faith-based organizations, as well as, of course, the Commission, and in spaces dealing specifically with social justice since 2011. I've written extensively, including for the Mail and Guardian and other publications as well. And as making up our panel this afternoon, first and foremost, and I'll just ask our panelists to wave as I introduce them one by one. The first panelist I'll introduce you to is Dr. Mariame Sylla, Chief of Health, HIV/AIDS and Nutrition at UNICEF South Africa since March 2018. She has previously served in various capacities in UNICEF offices, including Burkina Faso, Ethiopia, the regional office for West and Central Africa in Senegal, and the organization's New York headquarters. Before joining UNICEF in 2002, she worked in Guinea as a medical doctor and technical advisor at the Conakry City Health Directorate, and served as a global health fellow for the World Health Organization's global program on evidence for health policy in Geneva, Switzerland. A national of Guinea, Mariame holds a medical degree from the University of Conakry and master's degree in public health from the Johns Hopkins School for Public Health. And next, I will introduce you to Professor Lesley Bamford, specialist in the Child and Health Directorate in the National Department of Health, Ministry of Health, and is also an honorary professor in the School of Health Systems and Public Health at the University of Pretoria. She is a pediatrician and holds an honors degree in African Studies and a doctorate in public health. Her work concentrates on improving child health service delivery at community primary health care and district hospital levels. Lenore Spies is the Senior Technical Advisor Nutrition, Child Health and PMTCT, Maternal, Adolescent and Child Health Institute, and has a 30-year-long service history to the Department of Health in various capacities. Lenore was the director of the Integrated Nutrition Program in KwaZulu-Natal and led the largest nutrition team in South Africa and maybe even Africa. Under Lenore's leadership, the Department of KwaZulu-Natal led the way to the policy decision to stop the distribution of free infant formula and to align with the World Health Organization guidelines for breastfeeding in the context of South Africa, better known as the Tshwane Declaration. First and foremost, good afternoon to all our participants and as well as our panelists. And they were kind enough to allow me to refer to them by first name, despite all the experience and the expertise sitting around here today. I just want to alert all the participants, all the people watching this session, that we do have a chat function. So if you have any questions, if you have any comments to make, please refer to the chat function. I'll direct those, as many of those as possible, to our participants. I see that we have many people joining us on our webinar this afternoon, and I really appreciate it. We also have a poll, and I'll quickly read that out for you, and I'll refer to it every now and again, giving you an opportunity, obviously, to vote in the poll. And the poll question is, who do you think should step up the most in its efforts to prevent child nutrition amid COVID-19? And your options are, thus far, government. Thus far, the poll standing at government, private sector, donors, funders, community, civil society, and parents. Those are your four options that you can go to. And then just as a final bit of advertising, we do also have an offers section. You will see it on the webinar page on your right-hand side, just below polls. So please do also click there for further information if you so wish. And with that, I'm going to immediately turn to Professor Lesley Bamford to set the stage for us, to set the scene around what the discussion is this afternoon. Good afternoon to you, and thank you for giving us a wonderful introduction there, Lesley.
Good afternoon, and good afternoon to all the participants. So, I see that our topic today is COVID versus child nutrition, and I think we need to be careful that we don't put those two on opposing sides. The reality is that we need to deal with COVID-19 infection, but we also need to deal with improving child nutrition in South Africa. If we take a step back, we know that under 5 mortality in South Africa is declining. Fewer children are dying, so our child survival is improving. But despite that, we know that many children still fail to thrive. And one of the key ways that we know this is that we look at our stunting level. And more than a quarter of young children in South Africa are stunted. That means that they have not achieved the expected height for age. And this really is a sign of long-standing or chronic undernutrition. Other things contribute towards stunting, but one of the main driver of stunting is undernutrition. Our rates of what we call acute malnutrition that we measure by wasting are lower. About 2 to 3% of young children in South Africa are wasted. But it's really this high stunting rate that really concerns us. Now, addressing undernutrition in children requires that all mothers and children have access to a package of nutrition services that focus on promotion of healthy growth and development, and then on prevention, early identification, and management of malnutrition. And we need to recognize that the COVID pandemic does pose a number of threats to each of these components. And I think that government and others really have been trying to mitigate these risks. But we also need to recognize that the severity and the rapidity of the COVID-19 pandemic have made this difficult, and there are gaps in our response. So I think if I could take a few minutes just to flag quickly what the package that we are as government aiming to provide to children, what is in that package. First of all, we need to acknowledge the role of households in child nutrition. Households play an incredibly important role, and families need to have correct knowledge about optimal infant and young child feeding. And the key things that we would like families to be doing is we would like mothers to be breastfeeding, and that means exclusive breastfeeding for 6 months, followed by ongoing breastfeeding. From 6 months, caregivers need to introduce high-quality complementary feeds, but we would like them to continue to breastfeed until the child is at least 2 years of age. Now, obviously, families need to be supported to do that. And we think of the support, first of all, at community level, with our community health workers playing a very important role, providing information, supporting household nutrition, and assisting with early identification of children with malnutrition. Our health facilities and health workers also play a very important role to support optimal feeding practices. They provide interventions that support good, healthy growth, and they need to provide treatment and follow up for children with malnutrition. And then very importantly, we as the health department understand that we need to work with other government departments in an inter-sectoral way to improve household food security through poverty reduction, through social grants, through poverty relief. There's a range of ways that we need to improve household food security. And we need to also focus on improving basic services, especially access to water and sanitation. And then, of course, something that has been in the news is that we do work with the Department of Basic Education in providing the National School Nutrition Program. So what I've tried to do, that's not exhaustive, but just to outline what we would consider as a package of services that we are trying to provide. And we know that there has been a lot of disruption of health services, particularly during lockdown 5. And the focus on COVID-19, so our community health workers have not been going to households. Families have not always been able to access health services. And then, of course, we know that the pandemic and the lockdown has had a severe effect on household food security. So I think just as kind of a opening gambit, those are what we're trying to do and some of the challenges that government is really facing during this period.
Thanks for that, Lesley. Thanks for setting that scene. And I think that immediately takes us, I think it's a wonderful launching pad to take us into our first point of discussion, and that is the notion of strengthening the health system response for nutritional care to ensure the continuity of nutrition services, especially in relation to the early detection of malnutrition. But I guess one of the key things that always comes up in conversations like these, especially around health, is that prevention is better than cure eventually. And Lenore made a very important point earlier. You also made the point looking at the issue that, or looking at the role of breast milk and the impact that it has in lessening malnutrition. So maybe if we can start expanding on that, what are some of the health responses that are required to minimize malnutrition? And then obviously, what do we do then from a health practitioner perspective or from a health department's perspective, what is needed to deal with malnutrition? Lenore, could I start with you?
Yes, thanks, Gershwell, and hello to all. I think in terms of prevention, I think Lesley has outlined some of the details of the package that the Department of Health provides. But certainly in terms of prevention, we definitely need to we need to move to actually identifying cases for intervention and for support as well. So, and that's from a health system response. Obviously, the whole issue around malnutrition has got a multi-sectoral response, and multi-sectoral, they all play different roles in supporting prevention. So in terms of prevention, we would like to see that the health service moves quickly and rapidly to identify children with malnutrition before they make the intervention. And that is to support children to come to the facilities as much as possible so that we can do the basic package of services like identifying them when we provide services for children. And then also at a household level as well to do some type of community-based screening and community-based interventions to identify the children early so that we can make those interventions. So it's a combination of household level activities, community-based screening and interventions, and the health facility-based interventions, which was around the package of services that Lesley spoke about, which will identify the children earlier so that we prevent it. Obviously, on a bigger macro perspective, outside of the health facility, there are other bigger interventions, in the whole social political framework that we need to work on to prevent malnutrition, because it's not necessarily just identified and settled within the health sector.
Mariame, it's this particular point, and look at the issue of whose role this is ultimately, and I think it speaks to the poll that we're running at this point in time, because I think as society, what we tend to do is that we like siloing and boxing in and categorizing and saying that this is a response that's required from government, this is a response that's required from civil society and communities, this is a response that's required from the private sector. When talking about child malnutrition, ultimately, whose responsibility does it come? And I'm sorry for asking seemingly what seems to be a very obvious question.
Thank you very much. As my colleagues mentioned, it's a collective responsibility and individual responsibility, if I may say. Collective in the sense that, of course, government set the directions and provide guidelines and the safe social safety. That's one part. But at individual level, household level, also there are some responsibilities in terms of, but they also need to know what to do. So we, in terms of capacitating mothers to identify very early on cases of malnutrition at home is one thing. Exclusive breastfeeding, which is available, and promoting it, protecting it is one thing. Civil society organization has a huge role to play in empowering families. Private sectors, the agricultural sector, where the food system is key, is also one aspect where we need to work with the multi-sectoral part of it. And I also want to bring up the safety. I think when the COVID-19 started, government swiftly increased the child support grant, which was very welcome to families that cannot afford food when they are not working and they're losing their income. So I think it's a collective, as I said, and individual responsibility of all of us to come together and support children nutrition in South Africa. I think I wanted to add one point to what my colleague said, the data. For now, we haven't been able to identify, so far, the data we have is from April, when it's come to severe acute malnutrition, for instance. We need to look at for May, June, to be able to say effectively what's the impact of the COVID on child nutrition. Then we can see a trend and be able to tailor our approach in addressing child nutrition.
I mean, it's a very valuable point that you're making there. I think that as we speak, you know, especially within the South African context, we got so much data from the first quarter of financial activity, increased unemployment, an economy that's in recession. And the reason why that would be important is because ultimately it has an impact on household incomes and how well people are able to feed their children instead. So I think that is such an important point that you've raised there. But I'm just quickly turning back to the poll that I mentioned at the beginning of our discussion, and some of the votes have started coming in. And I'd like to share with you what our participants are, what their thinking is about. Of course, for those who may have joined late and don't know that we're running a poll, we're actually running a poll at this very moment saying, and the question is, do you think, who do you think should step up the most in its efforts to prevent child malnutrition amid COVID-19? And at 65%, people are saying government, the private sector at 4%, donors and funders at 5%, and community, civil society, and parents at 25%. That is what the poll results show at this stage. So clearly, the vast majority of our participants, almost 2/3 of them, are of the opinion that government needs to play a greater role in this. And just also to remind all the participants and all the people watching this that you can ask questions via the chat function. But that brings us then back to an important issue, is that during COVID-19, where social distancing is key and essential, where there's been a slowdown in economic activity because we need to keep people safe from interacting with each other and thereby spreading this virulent virus, schools being closed, and we're only seeing young people returning back to school. And of course, within the South African context, we know that schools are very important because that is where many children actually get their, that one nutritious meal that they require. I'll turn to you, Lesley. I mean, how do we then mitigate the burden of malnutrition within that particular context, within the COVID-19 context that we're dealing with at the moment?
So I think it is very challenging. It is a challenge that government has faced. First of all, just in terms of the school nutrition program, so it really was a problem that in the majority of provinces, when school closed, the school nutrition program also closed. Now that schools are opening, Department of Education has committed to restarting the school nutrition program so that even learners who are not attending school, because as you are aware, some grades are back, other learners are still not at school, provision has been made that those children can still come to school to be part of the school nutrition program. I think there have been quite a lot of teething problems getting that up and running again, but the intention is that the school nutrition program should be up and running and providing meals to all children who are eligible. Social development, as you know, there have been increases in child support grants, although I think, again, there have been challenges in uptake. So problems with administration and those child support grants not necessarily reaching all the intended beneficiaries. So I think it really needs a combination of interventions. From speaking from the health sector, I think there are two things that we are focusing on. The first is to minimize the disruptions to service delivery. So there have been concerns around, is it still safe to breastfeed? And we need to state very clearly that breastfeeding is even more important during this period. We are trying to mitigate the risks or the disruptions to health services. We are hoping that our community health workers will be back in the field focusing on maternal and child health services. We are monitoring what's happening in our primary healthcare facilities, but the number of children coming to our facilities is still down. So most months we see about 1.5 million children. For the last 2 months, we've been seeing 1 million children. That's in April and June. We do also need to prepare, because with increasing food insecurity, as we get over the COVID epidemic, we will expect to see more children who are undernourished. We're not seeing those children yet, mostly because of the disruption to our services, but we will put more emphasis on early identification and management of children with malnutrition. And then thirdly, I think we've talked about the inter-sectoral collaboration and the importance of working with other departments. There is a very well-written national food security plan, but we are going to have to focus much more on making sure that the interventions outlined in that plan are actually implemented.
Sorry, with these meetings, one tends to forget to unmute. Thanks for that, Lesley. The next question is for you, Mariame, and I think it's squarely aimed, directed at UNICEF. It's from Chantal Witten, asking, what is UNICEF doing at the macro level to address food shortages, especially for children? Households will not be blamed if they do not have access to food. I think going back to the issue of the COVID-19 pandemic at this stage, strengthening or maybe enough increasing inequalities and poverty as well. And that leaves a lot of people with the inability to access something as basic as food.
Thank you very much for the question. In terms of food, procuring and providing food to children, we do not do that directly as UNICEF. However, we do the best we can to make sure that the food that is being distributed through DSD is nutritious, and that it doesn't include, it's nutritious in terms of quality that they are receiving. It doesn't include what wouldn't be beneficial to the children. That's one thing. We also supported the National Department of Health in defining those guidelines that they provided to DSD. We are hoping that when school starts, the meal also being provided to children, there are standards, but those standards are adhered to strictly. So I think it's a quite, for us at least at UNICEF, what we are trying to do is to make sure that every child that is being reached with the food parcel that government is providing, those standards are well adhered to. The point you made about equity, I think, is something that we are very paying attention to, because even before COVID-19, if you look at stunting, poor children were 3 times more likely to be stunted than children that are well off. So we are trying to see that when these food parcels have been distributed, that effectively children that are in the poor areas are prioritized as it was intended to be.
Obviously, one of the key challenges that we are facing with the current circumstances is all of us are at home, all of us, or not all of us, but the vast majority of people are at home. We're trying to minimize contact between people, so which means that there are fewer people in work spaces, in school spaces, etc., etc. And I think one of the key challenges, Lenore, no matter how well intended you are, no matter what plan you're drafting, no matter what the data is telling us, is being able to reach everyone under circumstances of very limited resources. How then do we band together all of the various stakeholders in the state, civil society, and of course the role that families play, because they're not escaping without any culpability in this discussion. How do we band together and then have an effective response whereby we not necessarily be able to immediately eliminate childhood malnutrition, but at least we can minimize its impact? Because I think all three of you would be able to attest that child nutrition and the impact that it has now impacts us into the future as well.
Yeah, agreed. Thanks, Gershwin, for the question. I think the biggest thing for me would be that there has to be a much greater level of coordination amongst all these role players. There has to be a far greater level of collaboration and support amongst each other to get these type of messages out. Because I think that sometimes that we tend sometimes as organizations, civil society, government to function in particular silos, and there's not enough coordination so that we get individual responses as opposed to a collective response, a collaborative response which would support it better. And added to that, I think if we do that, then we get much greater impact and effect of the things that we do. Like, for example, even the messaging that is sent out. At the moment now, it is so important. The only big messaging coming out on COVID-19 is really coming through a lot of platforms around government, that government puts out on their websites or social media platforms or on the TV, but primarily coming through that, through government. Sorry, there's just a echo. So it's important even as the coordinated body of all of us as
sorry to interrupt there. I do agree with you, Lenore. Can I just ask the two participants as well, can we just mute our mics, and then we'll unmute once we talk again.
So the point I was trying to make was that it's important then in these coordinated, if we were all properly coordinated and all working together in one sort of all of one platform, then we would be able to use these facilities that we have available to us more effectively. So I'm taking the example of, say, for example, the messaging. And to a large extent, I've not really seen a lot of messaging around nutrition in COVID. I've not seen a lot of messaging around specifically focused on children in COVID, the need to bring them back to facilities. We keep generalizing about the services, people must come and access all the service or chronic diseases, but there has to be sort of more focused messaging on the need for children to come back so that we can support them and deal with those that are sort of at risk of becoming malnourished. And I think the biggest thing for me would be that if we did it as a coordinated mechanism, in a coordinated way, we would be able to get much more leverage out of all these activities that are going on. Because sometimes, you hear piecemeal of things where you need just to hear a very much, okay, this is the key message. This is what we need to put out. This is how we need to do it. And I think that needs to be coordinated more and done more so that we effectively hear of these things.
We have
come back.
Thanks for that, Lenore. We have a robust bunch of viewers, participants for the webinar, and many questions are coming through. Mariame, I'm going to turn to you because two of the questions relate directly to the role that UNICEF is playing, and I'm going to ask it as a double-barrel question. I hope you don't mind. I'll start with a question by Sarah Nevote, asking what is the status of the food security and nutrition strategy UNICEF and NDOH were working on last year, which was multi-sectoral in nature. And then there was another one that came through after that, asking again by Chantal Witten, asking would UNICEF have that coordinating role? Remember the question that I referred to Lenore earlier on, of trying to coordinate the various efforts by civil society, the state, as well as the family, for lack of a better term, and the community as well. So that's your double barrel question for now.
Thank you very much. I'll start with the last question. Indeed, we are we're working very closely with the National Department of Health in terms of supporting the district and the provinces to come up with plans, as mentioned with my colleagues, when there is an increase in numbers of severe acute malnutrition or moderate acute malnutrition. So the coordination within governments and the provinces, we are supporting that, of course, behind the scene, not we supporting governments. And we also are working very closely with NGOs, civic society organization, and coordinating between NDOH and Department of Health and this civil society organization, academia. It's a start. I mean, it's not optimum yet. We just started. We work on it. It's work in progress. We've identified areas where we feel there is a need for improvement, which coordination was one of them, data was one of them, and elevating, like my colleague mentioned, child health in general, child survival within the COVID agenda, because COVID was overshadowing that agenda. So we've identified. It's work in progress. We will have to improve, and UNICEF is willing and available to provide that support. The third area where I think UNICEF is well placed is the community-based interventions. You have experience in many countries across Africa where we're working very with community health workers, families, in identifying very early on severe acute malnutrition at house. So that experience, we can bring it back to South Africa, of course, contextualize it and adapt it. And that's one in terms of coordination. But also beyond the health sector, my colleagues, I have colleagues that work with the education sector, with the child DSD. So we have that opportunity and are well placed to facilitate cross-sectoral collaboration. That's in terms of collaboration and coordination. The coordination, the document that was drafted last year, of course, it was a multi-sectoral. We consulted. We still haven't finalized it, but I think the draft is in a good shape. We're waiting, and it was supposed to be finalized, and then COVID-19 hit, and I guess everything was put aside, but this is a good opportunity now to bring it back and then finalize it and disseminate it.
Can I just add, or can I just use this platform for a bit of leverage, Marianne? In that document, they called for a national advisory committee on nutrition. And I think one of the key things, we've seen successes with the AIDS Advisory Council and now with the COVID Advisory Council. So I think if you talk of that coordinating body, I think that it would be quite, I would like to advocate for the establishment and moving forward with that type of advisory committee, both to government, obviously, and to yourself as coordinating. Thank you.
Thank you. And this gives us an opportunity to coordinate amongst ourselves, I take it, in these discussions, in strengthening the response specifically against child malnutrition. I just want to quickly pop in back at the poll that we're running at this stage. And just as a reminder, the question is, who do you think should step up the most in its efforts to prevent child malnutrition amid COVID-19? 62% of you say government, 4% of you say the private sector, 5% of you say donors and funders, and 27% of you say community, civil society, as well as parents, as a unified category there. But Lesley, I want to turn to you now, and I don't want to give the private sector too much of an escape opportunity in this discussion, because I don't think we've necessarily touched on the role that the government plays in this particular instance, and it seems that Lesley has left the room. She's rejoined. That obviously we have a multi-sectoral approach, that there's many people who have a role to play in this particular discussion. And my question on that basis then is, to you, Lesley, is what role then does the private sector have to play in all of this, taking into account that we live in a world where the private sector plays a role of profit and trying to obviously make money, make the bottom line for themselves. But what role can the private sector play in alleviating malnutrition, especially amongst children?
Sorry, I'm having some connectivity problems, but I think I did hear the question. So I think that the food industry is an important role player. But one of the contributing factors to increasing food insecurity in this period has also been increases in food prices, and I think that is an area where really the food industry needs to come to the party and stop marketing unhealthy foods for children, and in general just be more regulated and contribute more towards ensuring that our children have healthy diets.
I want to come to you, Lenore, on this on this very question of what role, because we're living in the COVID-19 era, right? And I think for many of us, it's a shock to the system, but wearing a mask in public, constantly sanitizing your hands, literally all of us become experts at being able to tell how far meters is or 1.5 meters is under social distancing. People who WhatsApp you or call you and say, I'd like to pop by, you say, no, you need to stay away from me, no visiting during this period, etc., etc., etc. But what have we learned from all of that, from that set of circumstances in terms of what our responses need to be in dealing with child malnutrition? And more importantly, the approach that we have at this stage, is it sufficient in addressing this new reality that we occupy?
Well, personally, I don't think it's sufficient at all, and I don't know if it's a function of us having not seen the numbers yet. But I think, based on what we've seen in terms of the way the disease progresses, we are definitely, and with the economic situation the way it is, and again, I don't want to talk about the food parcels or quality of food parcels, but we trust that whatever the food parcels are, they are child friendly and have some items there that are for the benefit of children in the food parcel. But having said that, I think that we are definitely, for me, I would definitely predict. And certainly, I don't even want to predict, but certainly they have been modeling, let me say, even all the people watching, they should be familiar with the modeling exercises that have been done that were published recently in I think it was Lancet, yes, in the Lancet, in the Global Health Review, where they actually predicted and modeled how many actual child deaths we are going to have with this type of decreased coverage in COVID. And, before you get death, you get some type of morbidity, you get some type of illness first, and people in some way end up in hospitals or in clinics, so they need some help before, you actually death is the end result. So I think that these, the modeling numbers that I've seen have been quite staggering, to see that the number of people with this decreased coverage, and now Lesley's given us an indication of the decreased coverage that we've seen, from 1.5 to 1 million. And as kids don't come to facilities more, so we will not pick them up more and see them. And what I'm concerned about is that whereas they progress to moderate acute malnutrition before they become severely acutely malnutrition, we will be skipping the stage now of moderate acute malnutrition and just be rapidly becoming severely acutely malnourished. Which means that the wasting, and this high degree of wasting has even got a higher association with mortality. So I think the thing that scares me most in this COVID linked to malnutrition is the rapidity, how quickly you can progress from just being normal and fine, okay, and to becoming directly down to being severely malnourished. And I think that is what we must highlight both to all communities, to all the role players, to NGOs, civil society, government, that it can be so rapid for a child. This child is small, it's under 5, still growing, developing, and now it has the sudden shock, and so quick and so fast. And I think that for me would be the biggest thing, that people need to, we need to raise it and raise that level of awareness. I think that sometimes, community health workers, as Lesley says, have been redirected to do, COVID screening in schools or do other things or deliver medication now that people aren't coming to health facilities. And we need always to be advocating for and using any platform to say, what about finding those children in the community to bring them back? Because I think that would be sad. We also know from child health reports and, the comic reports, I'm using acronyms now, but so we get that a lot of these children die at home and we don't even see them in the facility. And I think that for me is, is really worrying. Because we don't want to have these children, as they know. We know that a large number of the children die at home, and they don't come to our facilities. We don't record their deaths as been happening in facilities because they get so ill so quickly at home, and before they even come to us and we can help, they've already died at home. So I think that for me would be the biggest thing in this COVID environment, that we need, to be people aware that these children under 5 are particularly vulnerable. And that we really need to be focusing, that even the services for COVID in health facilities and nurses are focused on testing and tracking and tracing and doing many things. And we must not let the children fall through the cracks.
And I know that we obviously having a bit of a parochial discussion, so we're largely focusing on South Africa. But Mariame, turning to you, this year is based on what Lenore, the picture that Lenore has painted, that context ultimately, if one is to scale it up, then becomes a global problem where even if we had somewhat of a handle, and I think all of us here would agree that we haven't quite gotten a handle on child malnutrition, but what we've seen on a global scale at least is that the situation has most certainly gotten worse.
Yes.
Or could potentially get worse.
It's a global problem. It's a universal problem everywhere. Not only on nutrition. Children are of course not directly impacted, thankfully, by COVID in terms of morbidity and mortality. But the effect of COVID on children is the greatest in terms of access to services, the immunization coverage in many places, schools being closed down almost in most countries. So the impact of COVID on children, even though not visible, is huge. And if we don't take action now to prevent that, we'll felt it for generations. Because now we talk about severe acute malnutrition or wasting, but the impact on stunting would be for 2-3 generations because it has. So globally, of course, not only developing countries. If you follow news, you will see that England has the same. They are distributing food. Many countries are facing, even the developed one, are taking action to mitigate the impact of COVID on children in general, but also nutrition. Yes, even before COVID, one in 3 children globally one in 3 children were already malnourished globally. So COVID has just put at the forefront the nutrition as the key. If we want, in fact, to mitigate the impact of COVID on children, nutrition should be at the center of it because nutrition is the foundation. We've seen that 50% of children mortality is the underlying cause is malnutrition. So if the impact of COVID continue, we will see that all the gains we've made on child survival may regress because pneumonia, diarrhea are all exacerbated by the nutrition status of children. So yeah, South Africa it's part of the bigger problem. So we need really to advocate and bring that at political level, so that children are not become the face of this pandemic. Otherwise, we will have to deal with the consequences when we've dealt with COVID. Then we'll go back to more cases of malnutrition, pneumonia, diarrhea, and so on and so forth.
I mean, on that basis, and I guess, Lesley, this is where the conversation gets really interesting. Zama Kumalo, via the comments, says, agree and disagree with the poll results. Other government departments, other than health, definitely could improve their efforts. But overall, government is already carrying that responsibility as it is. Other stakeholders need to take up space and play their role. And I think that's as obvious as a blue sky on a clear day. That all of us need to play a role, and that yes, government does have to play a role. But the question that I have for you, Lesley, is how is the Department of Health in particular grappling with the what we can refer to as the post-COVID-19 world and post-COVID-19 reality, where many experts at the World Health Organization at an international level are telling us that what we're going through right now is something that could be recurring for up to the next 5 years, that there's a possibility that something worse than COVID-19 could come back, and that this thing can morph and evolve as time goes on. So ultimately, is government preparing itself for that new world that we're not necessarily looking forward to, but we need to be prepared for? And I'm just going to ask you to switch on your mic again, please.
I think that's a tough question. I mean, I think we do need to recognize that really no health system has been adequately prepared for COVID. Even much better resourced systems have really taken a battering with COVID, and South Africa is no exception. COVID is going to be with us for some time. And I think we have to accept it as the new normal. We are going through the initial surge, and that has disrupted routine health services severely, as everyone is scrambling to deal with the initial phases of the pandemic and trying to mitigate the loss of life and loss of livelihood associated with that. But I think, as I started by saying, we do need to rise to the dual challenge of dealing with COVID, but also making sure that we don't lose the ground that we have gained in terms of child survival, and that we do strengthen our efforts to address undernutrition in children, and particularly stunting. So I think it's a big ask, but as I say, I think we need to rise to the challenge. Maybe just to make one comment. I think we talk a lot about intersectoral collaboration between government departments and between all role players. I think that is critical, and I think we should do it better at national level. But real meaningful intersectoral collaboration, in my experience, usually happens at local level. And for me, that's one of the things that we need to get right. Those linkages between the different government departments, between civil society, with other role players. That interaction is often most meaningful when it happens at local levels.
I'm going to stay with you, Lesley, if you don't mind. There's another question that came in from Laurie Lake, and I think it's an important one, asking, does the Department of Health have funds to support therapeutic feeding to support rehabilitation of children with SAM?
We do have funds. Those funds sit with the provincial departments of health. They are budgeted for, but sometimes we know that when there are shortfalls in other areas, those funds may be diverted for other causes. So one of the interventions that we are busy with in trying to mitigate the risks is to communicate with our provincial departments of health and to indicate to them that they do need to make sure that those funds are available, that they are likely to require additional funds above the baseline amounts to provide therapeutic treatment, ready-to-use therapeutic food and other supplements that are required for children with severe acute malnutrition. So that really falls, I think that, as I said earlier, I think that there need to be two areas of focus. The first is mitigating the current crisis, but also planning and preparing for the anticipated increase incidence of severe acute malnutrition that we do expect to see. We don't really have a good sense of how big that increase is going to be, but we do need to start preparing for it.
I'm going to start with you, Mariame, if you don't mind. Anna Marie Miller asks a very important question. If there is data on increasing food prices, is regulation the responsibility of government? If we wait for private sector, we are creating an environment ripe for commercial determinants of malnutrition to play an even larger role in shaping children's nutritional status in this country. But of course, just as almost a caveat or as an addition to that question, I guess many market players will turn around and tell you that, well, COVID-19 has had an impact on food prices because of scarcity, etc., etc. So how then do we respond to this idea of whether we should be looking closely at the private sector and the role that it's playing in the cost of food? Sorry, your mic, please. No, we can't hear you yet. Let's try one more time. There it is. Yeah.
Yes. Still, it's a challenge. I wouldn't say that I have a ready available response to that, how to influence the private sector so that the pricing of the food, because they have the right pricing, it's important. But I know some countries have fiscal policies, some other countries where they review how they lower the fiscal, they review their fiscal policy so that agricultural sector is also taken into account. That's one thing. I'm not an economist to get into that, but I think those are policy options that can be looked into. There is also the fact that I think South Africa have done that. The sugary drink is the tax for sugary drink also is a policy, so that that also is done. It's a policy that can generate funding for the nutrition sector. That's the second point I wanted to make. The private sector, definitely we need to bring them around the table, because there is no way this can be only government or NGOs or the UN. The private sector has a huge role to do, especially post-COVID. So I think we need to also, for us, we need also to engage more with Treasury, because we usually we shy away from it because of our training. But I think if we want to talk about the private sector, we need also to engage more with Treasury to see how these fiscal policies can be applied to the private sector. I know I'm not responding the way it's up, because it's a complex it's a complex issues, and the conversations is just starting from our side.
I think it's a fair response. I think that we also need to take account of the fact that you have many systems from a global perspective, but that different interventions, and sometimes not the most obvious interventions, actually go a long way. A sugar tax, as an example, is what we refer to it as colloquially, is something that generates excise funds that then can in turn be injected back into the fiscus for school nutrition programs and that type of thing. So, I mean, it's an important point that you raised there. Terry Bell asks a question: if we have food security in South Africa, why do we have 27% plus children growing up stunted? And is it not true that chaos and confusion reigns in the ECD sector, where so many children rely on their one decent meal a day? Lenore, I'm going to give you the final bite of the proverbial cherry on that question. I think specifically looking at the broader conversation that we're having here around the fact that, you know, on a net level, South Africa is a food secure nation. So why do we then have such a high prevalence of nearly 1 in 3 children being stunted? Your microphone, please. Just switch it on first. No, it's still off.
It's on now?
Yes, it is. Thanks. The pleasures of video conferencing.
So I think we come back to this whole big chunk of discussion around the socio-political, economic determinants of health and nutrition and malnutrition specifically. And I think that, yes, we may be food insecure, but who is food insecure within South Africa? And it's this whole question again of equity. It's this whole question of how the political system works, how the economic system works, who gets access, what it costs to get access. So I think it's a much bigger question than just being able to answer in a one-line type of answer. But I think as a country, we do need to look carefully, and this is an ideal opportunity, and you heard the president speak about it, to look at some type of restructuring at a very macro level so that there's greater equity in our country, you know, to try to address these, so that there's some type of equitable distribution of wealth within the country. And I don't think we must shy away from that type of redistribution so that we don't have that. And then having said that, also just to say, as I see time is running out, my last little picture is that also, you know, I've been reading the Global Nutrition Report, and there's a striking comment that they make, which is absolutely true, having watched your TV, that COVID does not treat us all equally. And it comes back to the same point. We are not all treated equally by COVID. We know who is most affected. And we can see that in terms of the disparity, in terms of who are affected and how they're affected. And the same must apply to malnutrition. And I always say this personally when people talk to me about malnutrition, it's a bad indictment on our country. All these years post-democracy that we still talk of having so many kids that are malnourished and so many children that are prone and susceptible to hunger in this age in our country, where we have this food security and where we've had this development. And if we need to go back to starting to measure, again, I was saying to Marianne early, nutrition is an outcome of development, which we've been saying for the last 20 years when I started my career, and I'm still saying it almost ending my career, then that's what we need to do. So that it becomes a developmental indicator so that, again, these issues of food security, food, access are all addressed. Thanks, Gershel.
Thank you so much. And on that note, Marianne, if you don't mind, if you can give us 30 seconds as a final thought on anything that you want to raise. Lesley, I'll come to you afterwards. And then, unfortunately, a fascinating conversation needs to be wrapped up. I can't believe that an hour is basically done.
Very quickly, for me, we need to advocate so that children are safeguarded during this COVID-19 responses. Yeah, we need to respond to COVID-19, but we shouldn't forget that children should be at the center of that response in terms of the collateral or mitigating measure of COVID-19 impact on children well-being, children health should be safeguarded. That's one. Second, the point that Lenore made about equity. If we are not careful, COVID-19 would even widen the inequality in South Africa because it's impacting the poor already, COVID, but the mitigating measure would even have more impact on the poorer than the welfare society. That will be my two key messages.
Thank you for that, Marianne. Lesley, I give you the final wrap-up opportunity. If you can just switch on your mic, please.
So I would certainly agree with Lenore and with Mariam that we do need to look at the macro issues. I think it is an issue around making caring for children everyone's business. So we need to focus on the macro levels. We do also need to focus on household levels so that people have knowledge, that we have services in our facilities, in our communities, in our schools. I think it really is a multi-sectoral and multi-pronged approach that we're going to need to adopt, with our eyes on making sure that our children, as we say, don't only survive, but also thrive. Thank you.
On that note, I'd like to thank all three of our speakers this afternoon. It was an absolutely stunning webinar. I think we've covered a lot more than what you expected us to cover in our discussion, from the questions that we've received from our viewers or participants, all the way through to the issues that have come up throughout the conversation. Just a quick reminder, please go to www.mg.co.za/webinars to find out more about the Mail and Guardian's webinars. We thank UNICEF for sponsoring this discussion, of course, this webinar. Without you, this wouldn't have been possible. I just want to quickly check in with the poll results as a final thought before I say my final goodbyes. Remember, the question was, who do you think stepped up the most in its effort to prevent child malnutrition amid COVID-19? And the answer and the responses thus far say 62% of you say government, 4% of you say the private sector, 5% say donors, funders, and 27% of you say community, civil society, as well as parents, which has been pretty consistent throughout this conversation. But again, once again, thanks to you, Dr. Mariame Sylla, of course, Professor Lesley Bamford, as well as Lenore Spies, for participating in this conversation. All the best to you. Cheers.